just want to start by saying that I appreciate all the comments. You guys are awesome. So responding to comments, was this caused from drugs? My heart failure and me having to have the LVAD was caused from drug and alcohol abuse. I used to be a tower climber, cell phone towers, worked on them for AT&T, Verizon, T-Mobile, Spectrum, DirecTV. Climbed, worked on them. We worked 16 to 18-hour days, so I was constantly fighting to stay awake and get my job done. So I was already on Adderall since I was 12 for ADHD, and I abused that. Well, the next best thing is cocaine when you run out of Adderall. So I was doing that along with alcohol, and then dealing with my back pain, I was taking Percocets. So I was constantly taking uppers and downers. I think that's what mainly caused my heart failure. I do have hereditary problems. I had a genetics test, so I don't have mutations, so I can't pass it on, but my dad did give it to me, if that makes sense. So I think all those combined is what gave me heart failure. I know I was getting a lot of messages, and there was some comments asking about COVID, and there's other people with LVADs that have gotten heart failure from COVID. I don't know if that was me. I never really tested positive for COVID, so I don't know if that was a factor. But the doctors, they're quick to sit there and take the easiest route and say it was drug and alcohol abuse, which, let me tell you about my drug and alcohol abuse. So I would drink about 16 to 18 Budweisers a day. And that was I was a binge drinker because I'd hide it from my ex-wife. The 16-ounce Budweisers. So I'd drive around and sit there and drink. Thank God I'm sober now. But I would sit there and do that, and then I would take my Adderalls. I was prescribed 3 30s a day. Now I was taking about 6 to 8 of those a day. So I was not taking the 3 because I had ADHD, and it made me act normal if I took the prescribed amount, and I wanted to get that super juice, so I would take 6 to 8 of them a day. And then when I'd run out of Adderall, I would start using cocaine. I used meth a couple times to sit there, and when I couldn't find cocaine, it was constantly using stimulants. And then I would take Perk 30s for my back. I had a lot of back pain, hence why I was on gabapentin and why I got taken off of gabapentin. Well, I took myself off of gabapentin because it was giving me cloudy brain. I wasn't able to talk right, and I had slow speech already because, well, during my heart failure, I had also had a stroke, so that helped with my speech impediment. But so did the gabapentin. I'm off of it now. I'm starting to get my muscles back. As you can see, I kind of got that worked. I got my smile back. So I don't know, a bunch of factors. I would say it was mainly drug and alcohol abuse. Yes, to answer your question.